Dr. Branyon with New Hope Unlimited. Thanks for joining me right now. Today I want to talk about how our patients always come to us and say, what am I going to eat? What meats can I eat? I hear I can't eat any red meat. It's got to be all fish and chicken. And oh my goodness, that's going to be so boring. It's been boring. And you know how it goes. It's true. We love our food. So in this video, I want to tell you when we at New Hope Unlimited will tell our patients, go get you a good, juicy, organic steak and enjoy. So before I tell you when we will tell that to a patient, I want to explain that our bloodstream, I always call our bloodstream our tree of life, because everything flows through that tree of life, that bloodstream. It carries oxygen, it carries hemoglobin to everything from your brain to from top of the head to the bottom of the feet, even into that big toe and little toe. That bloodstream carries nutrients, hemoglobin, oxygen everywhere. So there's a time that a patient's hemoglobin may be getting low, or they come to us and it's low, or either they've gone home and we're still having to watch hemoglobin, and let's say they're in the United States. Now, the United States has protocols that we kind of don't keep on when hemoglobin drops. Let me explain. In the United States, when someone's hemoglobin drops, they will not give blood until that hemoglobin is at 7. Now at 7, you can imagine, if you haven't already experienced it before, you're going to be so lethargic, tired, not want to do anything. You know that you're not thinking good, and that's because when your hemoglobin is that low, you don't have enough flow in that life stream, tree of life called the bloodstream. Their hemoglobin is so low, and the hemoglobin is what gives you iron, oxygen. And when it's not getting to the brain, you can't think straight, you are tired, and that's not good. It's not good for even trying to heal. Now, we don't wait till it's 7. We feel like once that hemoglobin drops to 8, we're going to give some blood. Or, if there is maybe not quite low enough for that 8 to do a blood transfusion, we know the patient is getting too tired, they're not getting enough oxygen to the brain, they're not getting iron to where they need, they're just not functioning good enough. And now 8 and 7 is not where you are terminally going to kick the bucket, but if that hemoglobin gets lower, you can get in danger. When a hemoglobin goes to 7, 6, 5, 4, then you're in danger. We never, ever want that to happen. So let's say a patient of ours, okay? Remember, the U.S. will not give him a blood transfusion normally until it is 7. That's protocol in the U.S. Our protocol is when it hits 8, that patient needs to be bounced back. But let's say it's not quite 8. Let's say it could be, 9, 8.5, something like that. It's getting low. Good hemoglobin should be anywhere from around 13, 12, 13, and some men can be even as high as 16. Depends on which lab you're using. But when that hemoglobin gets low, but not low enough for a blood transfusion, ding, 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 we're going to tell our patients to go get a good, juicy, organic, got to be organic, steak and eat it. Now the reason for that, yes, steak is thick and dense and it's hard to digest, which is not what we want to be doing, but We'll always tell our patient to eat that steak during the day and not at night, so that they will digest it and be able to sleep well. But the thing about why we do the red meat steak instead of trying to load up on beans and rice and that sort of thing, there is a difference, and people don't recognize that. Plant protein, you're going to get your vitamins and minerals, but there is nothing that's going to build hemoglobin quick. Now, I'm not saying don't eat your beans and rice because they say it makes a complete protein. And vegetables, we need to eat as many vegetables as possible. But we're talking low hemoglobin now. We're talking needing to get oxygen to that brain. We're talking about building that patient back up a little bit so that they can fight. So plant proteins just don't do the job quick enough. Now, a good organic steak, that is amino acids, and that will pull hemoglobin up faster than any other thing other than a blood transfusion. So I'm just trying to say that for our patients, and you might want to think about it, if you've got a low hemoglobin and your doctor is refusing to do a blood transfusion because it's all protocol, then you might be trying to do plant protein and you feel like it's just not working. You might want to think about going and getting a good organic. It needs to be organic, please. You don't need those extra hormones and antibiotics and steroids. Needs to be organic. But you might want to go try one of that and see how well it works for you. It's very important that your hemoglobin stays up to where you can get oxygen so you can think clearly, not be fuzzy-minded, and feel like you are still able to conquer and get rid and conquer and do what you need to do to get well. That's important. Very important. Sometimes you just have to weigh some things out, and keeping yourself in good health the best you can while you're on your cancer journey is very important. I hope this helps a little bit, and why we will say every once in a while, red meat is not so bad. Now let me throw this out to you. Hamburger will not do the trick. It's got to be a steak. Hamburger meat just does not bring it together. So that's a whole nother story in itself. Thank you for joining me, and tell yourself you love yourself and try to mean it, and tell at least 3 people a day how much you love them and appreciate them. We need to pass more love around. We need it in these days. Thank you. And I do love you and appreciate you watching. Thank you.